Medicine information. Useful mnemonics. Medicine Information Center.
Cholinergics, e.g. organophosphates effects.
If you know these, you will be less dumb. Lacrimation. Excitation of nicotinic synapses. Salivation. Sweating. Diarrhea. Urination. Micturition. Bronchoconstriction.
Depression, 5 drugs causing it.
Proms. Propranolol. Reserpine. Oral contraceptives. Methyldopa. Steroids.
Hypertension, secondary hypertension causes.
CHAPS. Cushing syndrome. Hyperaldosteronism, aka Conn's syndrome. Aortic coarctation. Pheochromocytoma. Stenosis of renal arteries. Note, only 5% of hypertension cases are secondary, rest are primary.
Benzodiazepines, actions.
Ben scams Pam into seduction not by brain, but by muscle. Sedation, anticonvulsant, anti-anxiety. Muscle relaxant. Not by brain, no antipsychotic activity.
Beta blockers, side effects.
BBC loses viewers in Rochdale. Bradycardia. Bronchoconstriction. Claudication. Lipids. Vivid dreams and nightmares. D-inotropic action. Reduced sensitivity to hypoglycemia.
Beta blockers, main contraindications, cautions.
ABCDE. Asthma. Block, heart block. COPD. Diabetes mellitus. Electrolyte, hyperkalemia.
CA++ channel blockers, uses.
CA++ MASH. Cerebral vasospasm/CHF. Angina. Migraines. Atrial flutter, fibrillation. Supraventricular tachycardia. Hypertension. Alternatively, chasm. Cerebral vasospasm/CHF. Hypertension. Angina. Supraventricular tachyarrhythmia, migraines.
Warfarin, metabolism.
Slow. Has a slow onset of action. A quick vitamin K antagonist, though. Small lipid-soluble molecule liver, site of action. Oral route of administration. Warfarin.
Amiodarone, action, side effects.
6 Ps. Prolongs action potential duration. Photosensitivity. Pigmentation of skin. Peripheral neuropathy. Pulmonary alveolitis and fibrosis. Peripheral conversion of T4 to T3 is inhibited. Hypothyroidism.
Hypertension, treatment.
ABCD. ACE inhibitors/LNI antagonists, sometimes alpha agonists also. Beta blockers. Calcium antagonists. Diuretics, sometimes vasodilators also.
Captopril, an ACE inhibitor, side effects.
Captopril. Cough. Angioedema/agranulocystosis. Proteinuria/potassium excess. Taste changes. Orthostatic hypotension. Pregnancy contraindication/pancreatitis/pressure drop, first dose hypertension. Renal failure and renal artery stenosis contraindication/rash. Indomethacin inhibition. Leukopenia/liver toxicity.
Clopidogrel, use.
Cialopiridogrel is a drug that prevents clots, an oral platelet inhibitor, OPI.
Beta blockers with intrinsic sympathomimetic activity.
Picture diabetic and asthmatic kids riding away on a cart that rolls on pinwheels. Pindolol and cartiolol have high and moderate ISA respectively, making them acceptable for use in some diabetics or asthmatics despite the fact that they are non-selective beta blockers.
HMG-CoA reductase inhibitors, statin side effects, contraindications, interactions.
HMG-CoA. Side effects. Hepatotoxicity. Myositis, aka rhabdomyolysis, contraindications. Girl during pregnancy/growing children interactions. Coumarin/cyclosporin.
Therapeutic index, formula.
Tile. TI equals LD50/ED50.
Morphine, side effects.
Morphine. Meiosis. Out of it, sedation. Respiratory depression. Pneumonia, aspiration. Hypotension. Infrequency, constipation, urinary retention. Nausea. Emesis.
Beta 1 vs beta 2 receptor location.
You have one heart and two lungs. Beta 1 are therefore primarily on heart. Beta 2 primarily on lungs.
Pupils in overdose, morphine versus amphetamine.
Morphine, fine. Amphetamine, fat. Morphine overdose, pupils constricted, fine. Amphetamine overdose, pupils dilated, fat.
Atropine use, tachycardia or bradycardia.
A goes with B. Atropine used clinically to treat bradycardia. Reserpine action. Reserpine depletes the reserves of catecholamines and serotonin. Ipratropium, action. Atropine is buried in the middle, ipratropium, so it behaves like atropine.
Propranolol and related old drugs, usage.
Olol is just two backwards lowercase b's. Backward b's stand for beta blocker. Beta blockers include acebutolol, betaxolol, bisoprolol, oxprenolol, propranolol.
Succinylcholine, action, use.
Succinylcholine gets stuck to ACH receptor, then sucks ions in through open pore. You suck stuff in through a mouth tube, and drug is used for intubation.
Asthma drugs, leukotriene inhibitor action.
Zeofurlacast, antagonist of lipoxygenase. Zeoluatin, inhibitor of LT receptor.
Zafirlukast, montelukast, sinelukast, mechanism, usage.
Zafirluk-AST, Monteluk-AST, Chinaluk-AST. Antileukotrienes, for asthma. Dazzle your oral examiner. Zafirlukast antagonizes leukotriene 4.
Metabolism enzyme induces.
Randy's black car goes putt-putt and smokes. Rifampin. Barbiturates. Carbamazepine. Griselfulvin. Phenytoin. Phenobarb. Smoking cigarettes.
Zero-order kinetics drugs, most common ones.
PEAZ, sounds like peas, at a constant amount. Phenytoin. Ethanol. Aspirin. Zero-order. Someone that pees out a constant amount describes zero-order kinetics, always the same amount out.
Warfarin, interactions.
Academic QACS. Amiodarone. Cimetidine. Aspirin. Dapsone. Erythromycin. Metronidazole. Indomethacin. Clofibrates. Quinidine. Azapropazone. Ciprofloxacin. Statins.
Warfarin, action, monitoring.
WEPT. Warfarin works on the extrinsic pathway and is monitored by PT.
Osmotic diuretics, members.
Gum. Glycerol. Urea. Mannitol.
Diuretics classification in order of site of action.
Colt-P. In their sequential site of action along the nephron. Carbonic anhydrase inhibitors, at the proximal tubule. Osmotic diuretics, at the loop of Henle. Loop diuretics, at the ascending loop. Thiazides, at the distal tubule. Potassium-sparing diuretics, at the collecting tubules. Diuretics make patient pee like a horse, hence cold pee.
Diuretics, thiazides, indications.
Chic to use thiazides. CHF. Hypertension. Insipidus. Calcium calculi.
Diuretics, groups.
Leak over the CAN. Loop diuretics. Osmotics. Thiazides. Carbonic anhydrase inhibitors. Aldosterone inhibitors. Sodium channel blockers.
K+ increasing agents.
K-bank. K-sparing diuretic. Beta blocker. Assay. NSAID. K-supplement.
Alkalosis versus acidosis, directions of pH and HCO3.
Wrong. Respiratory equals opposite. pH is high, PCO2 is down, alkalosis. pH is low, PCO2 is up, acidosis. Metabolic equals equal. pH is high, HCO3 is high, alkalosis. pH is low, HCO3 is low, acidosis.
Corticosteroids, adverse side effects.
Cushing's bad MD. Cataracts. Up all night, sleep disturbances. Suppression of HPA axis. Hypertension/buffalo hump. Infections. Necrosis, avascular. Gain weight. Striae. Bone loss, osteoporosis. Acne. Diabetes. Myopathy, moon phases. Depression and emotional changes.
Steroid side effects.
Cushingoid. Cataracts. Ulcers. Skin, striae, thinning, bruising. Hypertension/hirsutism/hyperglycemia. Infections. Necrosis, avascular necrosis of the femoral head. Glycosuria. Osteoporosis, obesity. Immunosuppression. Diabetes.
Steroids, side effects.
Beclomethasone. Buffalo hump. Easy bruising. Cataracts. Larger appetite. Obesity. Moonface. Euphoria. Thin arms and legs. Hypertension/hyperglycemia. Avascular necrosis of femoral head. Skin thinning. Osteoporosis. Negative nitrogen balance. Emotional liability.